Welcome to Science Force, where science comes alive. Hello everyone. A very warm welcome to today's explainer. Today we are going to explore something absolutely fascinating, the intricate mechanics of human balance and that highly disorienting condition we know as vertigo. Whether you're a medical student looking for high-yield clinical facts, a life science enthusiast, or just someone trying to figure out why a family member suddenly felt like the room was doing cartwheels, we are going to break it all down together. Tell me, have you ever felt the world just completely spinning around you, even when you're standing perfectly still? Or maybe you felt like you were tilting or swaying and the room simply would not stop moving? It's a terrifying mystery when it happens, isn't it? You feel totally helpless. But there's a very logical, biological reason for this sensation. Defining vertigo. All right, let's dive right in. First things first, we need to establish exactly what this is. Interestingly enough, vertigo is actually not a disease itself. Nope, it's a specific symptom, a false sensation of movement. It's the direct result of a glitch affecting your body's balance system, which we call the vestibular system. This dizzy spell could last for just a few agonizing seconds, or it could painfully persist for days or even weeks. So here is our roadmap for this explainer. First, the illusion of movement. Then we look at the body's balance system, followed by what happens when those systems fail. After that, we'll cover the main causes of vertigo, how doctors diagnose a dizzy patient, and finally the treatments and emergency signs. Section 1. The illusion of movement. Let's make sense of the spin. So here's the absolute core of it all. Normal balance relies entirely on your sensory signals matching up perfectly. Think of your brain like a highly advanced GPS system. When it gets perfectly aligned data from multiple satellites, it pinpoints your exact location without a hitch. But if those satellites start sending mixed, confusing data, the GPS gets terribly confused. Vertigo is literally just a biological glitch. When conflicting signals reach the brain, profound confusion occurs, and that is exactly what creates that powerful illusion of spinning. Section 2. The body's balance system. The triad of spatial awareness. Now for the life science and medical students tuning in, getting this triad down is absolutely crucial. Human balance requires continuous input from three major systems. The visual system. Your eyes literally tell you your position and movement relative to your surroundings. The vestibular system, tucked deep inside your inner ear. This is your primary balance organ, detecting head movement and acceleration using intricate structures like the semicircular canals plus the utricle and saccule. The proprioceptive system. These are specialized sensory receptors in your muscles, tendons, and joints. They are the reason you know exactly where your arms and legs are, even if you close your eyes right now. And sitting right at the center of all this incredible engineering is your brain. It's the master integrator. It's constantly crunching the numbers from your eyes, your inner ears, and your muscles to calculate your precise position in space. As long as these three systems are speaking the exact same language, you stay upright. Section 3. When systems fail. But what happens when things go wrong? Section 3. When balance systems fail. Peripheral versus central origin. Statistically speaking, an overwhelming 80 to 90% of vertigo cases are peripheral in origin. That means the problem is localized right there in the inner ear or the vestibular nerve. Only about 10 to 20% are central, meaning they actually originate in the brain structures themselves, specifically the brainstem or the cerebellum. Now, differentiating between the two clinically is a massive deal. Peripheral vertigo is highly dramatic. You get this intense spinning, severe nausea, vomiting. It's a lot. But despite how terrible it feels, it's usually not threat-lifing. Central vertigo, on the other hand, is a completely different story. It actually presents with way less spinning, but it brings along severe neurological red flags like poor coordination, double vision, and weakness. This is a vital distinction for any clinician to make. Section 4. Main causes of vertigo. From loose crystals to nerve inflammation. So the single most common cause of vertigo is a condition called benign paroxysmal positional vertigo, or BPPV for short. And the mechanism here is just mind-blowing. Inside your inner ear, you have these tiny microscopic calcium crystals called otoconia. They belong in a very specific pouch, but sometimes they dislodge and float away right into the semicircular canals. You basically get rogue microscopic rocks in your ears. So when you move your head, like just rolling over in bed, these rogue microscopic crystals shift the ear fluid abnormally. The hair cells get massively overstimulated, they shoot a false signal to the brain, and boom, sudden intense vertigo. It's totally incredible how something so microscopic can cause such massive disorientation. When a doctor is trying to diagnose this, the subtle clues are all hidden in the duration and the hearing symptoms. BPPV attacks typically last only seconds to minutes with absolutely no hearing loss. Vestibular neuritis, which is nerve inflammation, that lasts for days, but again, no hearing loss. Labyrinthitis hits you with both vertigo and ringing in the ears, often right after a respiratory infection. Meniere's disease, that's caused by excessive fluid in the ear, triggering attacks that last for hours, complete with hearing loss and this really uncomfortable feeling of fullness in the ear. The subtle clues are literally all right there in the patient's history. Which brings us to Section 5, Diagnosing the Dizzy Patient, Clinical Investigations and Testing. You know, the eyes actually hold the key to this whole puzzle because the balance centers in the brain are deeply wired to the centers that control eye movement. Your eyes literally betray the inner ear secrets. When the inner ear misfires, it triggers something called nystagmus. These are rapid, involuntary eye movements. The eyes might violently jerk side to side, up and down, or even in a rotational pattern. Doctors actually watch the specific pattern of this nystagmus to pinpoint exactly which part of your balance system is glitching out. But beyond just watching the eyes, physicians have a pretty comprehensive toolkit. It always starts with a rigorous medical history plus physical exams to check your gait and balance. For BPPV, they do a highly specific positional test called the Dix-Hallpike maneuver. They intentionally try to trigger the symptoms to observe that nystagmus we were just talking about. They might also use audiometry to check for hearing loss or order CT and MRI scans if they suspect something central like a stroke or a tumor. Finally, Section 6, Treatments and Emergency Signs, Restoring Equilibrium and Spotting Danger. Okay, the really good news is that we have fantastic treatments for this. For BPPV, we use the Epley maneuver. This is literally clinical physics in action, a specialized series of head movements that literally rolls those displaced calcium crystals right back into the pouch where they belong. And honestly, it is highly effective. Vestibular rehabilitation, which is physical therapy that trains the brain to adapt and rebuild its own balance. Medications. For immediate relief from the awful nausea, medications like antiemetics and antihistamines are used. Lifestyle interventions. And for chronic conditions like Meniere's disease or vestibular migraines, simple lifestyle interventions like a low-sodium diet, managing stress, and getting enough sleep can be an absolute game changer. Emergency warnings. However, and please listen carefully here, we have to be exceedingly vigilant. If you or someone you know ever experiences vertigo alongside any of these massive red flags, I'm talking about sudden weakness, facial drooping, difficulty speaking, double vision, a severe headache, or just a total inability to walk, that is a medical emergency. These are the classic telltale signs of a stroke involving the brainstem or cerebellum. You absolutely must seek urgent medical care right away. Time is literally of the essence here. Conclusion. As we wrap up today's explainer, I want to leave you with a pretty profound thought. Just think about it for a second. How much do we take our brain's invisible, non-stop mathematical calculations for granted?
every single second of your life, your eyes, your ears, and your muscles are streaming millions of data points to a brilliant biological supercomputer just so you can stand up, walk, and look around without even a second thought. It's really only when the room starts spinning out of control that we finally appreciate the magnificent, delicate machinery quietly keeping us perfectly balanced every single day. So what are the invisible miracles of the human body are we completely ignoring right now? Keep learning, stay curious, and thank you so much for joining me today.
Thank you for watching Science Force.